I've undergone FGM at the age of 7. But I've experienced it with my sister, who was 5 at the time, and my cousin. And I was cut by a medical profession because my parents, my family were quite privileged, I guess, in Somalia. And apparently that was something that everybody in my family has gone through, even though as painful as that was. It would have been abnormal if I didn't actually undergo the practice. FGM has had a deep effect on me, especially the psychological impact was quite, and it's something that was quite severe, and it's something I'm still dealing with today. And in order for me to come to terms with it, I was lucky enough to have had health professionals who have created a safe space for me, not to only understand the harms of FGM, but actually to learn about my body for the first time. And what helped me, it was, again, having somebody who used the correct language when describing FGM. For example, FGM, it's a form of child abuse, not a cultural practice, as many would use. I hate the term harmful practice. That's not the right language when we talk about FGM. So for me, using the right language is absolutely key. We are talking about violence against women and girls at its worst form. I think it's important to remember that FGM, number one, is a global issue. FGM happens in Britain, the US, all over the world. I think in order to also tackle this practice is by recognizing and actually acknowledging that we all actually need to work together by doing work here in the West, but also the amazing work that's actually taking place in Africa currently. There's amazing African movements that are taking place at the moment. However, we cannot do this unless we recognize this is a global issue and we all must speak out against this practice and for what it is. What motivates me, it has been, number one has been my daughter. My daughter's been a catalyst of a lot of my work. And it wasn't about just protecting her from female genital mutilation, but realizing she lives in a world where we have an anti-women ideology. We are practicing patriarchy, basically. So for me, what motivates me is not just ending FGM, but we need to end all forms of oppression against women and girls. And what keeps me going, like I said, it's the idea that we need to protect girls from all forms of harm. The changes that I've seen over the last few years, I guess the only change I've seen so far is that we are talking about this practice. We're starting to call it for what it is, but it's not enough. What I would like to see, or what my priorities actually are as a psychotherapist, is by creating safe spaces where women and girls who've undergone the practice can actually learn this is a form of abuse. It's nothing to do with their culture. So for me as a therapist, that's all I can do. But what I would urge for others to do is to actually recognize FGM for what it actually is, and not the way it's been interpreted that it's a cultural practice. It's child abuse, and we need to recognize it for that. The advice I would give my younger self would be just one thing: not to be afraid to speak out. That would be my advice to my younger self. I think a lot of girls are being brought up to be fearful at all times. So I would say to little Layla that she shouldn't have been scared, and if she is scared, she should definitely speak out against it.